AMCA Online Practice Exam 102 questions with explained answers. Question 1. Dr. Jones and Dr. Brown decide to share a practice. Together, they share patients, expenses, profits, and assets. Which type of medical practice is this? Option A, group practice. Option B, clinic. Option C, partnership. Option D, sole proprietorship. The correct answer is option A, group practice. Explanation. A group practice is formed when multiple physicians practice together and share resources such as patients, expenses, income, and facilities. Question 2. The function of the platelet is to: Option A, cause the blood to clot. Option B, fight infection. Option C, carry oxygen. Option D, carry nutrients. The correct answer is option A, cause the blood to clot. Explanation. Platelets are essential for primary hemostasis because they adhere to damaged blood vessels, aggregate, and help form the initial platelet plug. Question 3. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 4. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policy holders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 5. Telephone etiquette involves: Option A, remaining anonymous to avoid any responsibility. Option B, leaving a person on hold until you have the answer. Option C, referring an emotional caller to the administrator. Option D, keeping your statements simple and to the point. The correct answer is option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 6. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 7. One mental health illness that can hinder patient education is: Option A, chicken pox. Option B, high blood pressure. Option C, Alzheimer's disease. Option D, depression. The correct answer is option C, Alzheimer's disease. Explanation. Alzheimer's disease can impair memory, attention, comprehension, and learning, which can make patient education more difficult and may require adapted teaching methods. Question 8. A fluctuating fever that returns to or below baseline then increases again is: Option A, intermittent. Option B, remittent. Option C, onset. Option D, continuous. The correct answer is option A, intermittent. Explanation. An intermittent fever returns to normal or below the fever threshold between episodes before rising again. Question 9. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 10. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 11. Aspirin and acetaminophen are examples of: Option A, analgesics and antipyretics. Option B, antitussives and decongestants. Option C, antihistamines and antiemetics. Option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 12. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 13. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 14. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 15. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 16. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 17. What position should the patient be placed in when performing an electrocardiogram? Option A, dorsal recumbent. Option B, supine. Option C, Trendelenburg. Option D, prone. The correct answer is option B, supine. Explanation. The supine position keeps the patient lying flat and relaxed, which helps reduce muscle artifact and allows consistent placement of electrocardiogram electrodes. Question 18. During assessment, the best source from which to obtain patient information is the Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 19. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A. The medical assistant can use capillary tubes for the blood collection. Option B. Draw a red top tube before the light blue tube. Option C. Fill a light blue to the top. Option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 20. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 21. Tachycardia is a pathology that damages mainly the Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 22. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation: light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 23. Managed care organizations control costs by: Option A, limiting patient enrollment. Option B, detecting risk factors early. Option C, discouraging patient visits. Option D, eliminating case managers. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 24. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation: the rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 25. Verbal facial expressions or body language, such as a nod of understanding, are called: Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is option D, feedback. Explanation: feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 26. What is the process used to wash and remove blood and tissue from medical instruments called? Option A, asepsis. Option B, sanitization. Option C, disinfection. Option D, sterilization. The correct answer is option B, sanitization. Explanation: sanitization is the cleaning step that removes visible soil, blood, and tissue from instruments before higher-level disinfection or sterilization when required. Question 27. A physician, specialist, or any person that provides medical care is known as the: Option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation: a provider is a healthcare professional or organization that supplies medical services to patients. Question 28. When using a number 10 envelope, where should the address be placed? Option A, 10 lines down from the top and 4 inches from the left edge of the envelope. Option B, 14 lines down from the top and 2 inches from the left edge of the envelope. Option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Option D, 14 lines down from the top and 4 inches from the left edge of the envelope. The correct answer is option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Explanation: the keyed placement centers the delivery address in the standard address area of a number 10 envelope so automated postal equipment can read it properly. Question 29. Which of the following is classified as abnormally rapid, deep, or labored breathing? Option A, hypertension. Option B, tachypnea. Option C, hypernia. Option D, hyperpyrexia. The correct answer is option B, tachypnea. Explanation: the source keys tachypnea. Tachypnea specifically means abnormally rapid breathing, while deep or labored breathing may be described with other respiratory terms, so the wording should be reviewed. Question 30. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation: the hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 31. What is the correct way to calculate pulse pressure? Option A, the number found when subtracting the diastolic from the systolic. Option B, the sum of the diastolic and the systolic. Option C, the pulse taken at the carotid location. Option D, the pulse taken at the apical location. The correct answer is option A, the number found when subtracting the diastolic from the systolic. Explanation: pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, which shows the pressure difference between heart contraction and relaxation. Question 32. One method to calculate heart rate from an electrocardiogram strip is to: Option A, count the small boxes between the R to R interval and divide by 1,500. Option B, count the number of small boxes in the R to R intervals and divide by 2. Option C, estimate by counting R peaks in 10-second strip and multiply by 10. Option D, count the number of QRS complexes in a 3-strip and multiply by 10. The correct answer is option A, count the small boxes between the R to R interval and divide by 1500. Explanation. At a paper speed of 25 mm per second, dividing 1500 by the number of small boxes between consecutive R waves estimates the heart rate for a regular rhythm. Question 33. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called. Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 34. The information of blood cells is defined as option A, hematopoiesis, option B, erythropoietin, option C, mean corpuscular volume, option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 35. Which of the following is considered a parasitic infection? Option A, Lyme disease, option B, rabies, option C, ringworm, option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 36. When the body has had adequate rest and no food for at least 12 hours, it is said to be in option A, hemostasis, option B, basal state, option C, homeostasis, option D, steady state. The correct answer is option B, basal state. Explanation. Basal state describes the body after adequate rest and fasting, when metabolic activity is measured under relatively standardized resting conditions. Question 37. Name this part of the electrocardiogram. Option A, R to R interval, option B, ST segment, option C, PR segment, option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 38. A blood sample is collected from a patient and the plasma is pink to red in color. Which of the following is the most likely cause? Option A, polycythemia, option B, hemolysis, option C, lipema, option D, agglutination. The correct answer is option B, hemolysis. Explanation. Hemolysis releases hemoglobin from ruptured red blood cells, which can make serum or plasma appear pink to red. Question 39. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the option A, fee schedule, option B, deductible, option C, allowed amount, option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 40. Identify the following rhythm. Option A, atrial fibrillation, option B, ventricular fibrillation, option C, junctional tachycardia, option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 41. A monitor that a patient wears for 24 hours is called an. Option A, Holter, option B, 12-lead, option C, Holter, option D, echocardiogram. The correct answer is option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 42. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 43. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 44. Which of the following statements is true under the doctrine of respondeat superior? Option A. The physician is responsible for any errors made by the medical staff. Option B. The person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C. The medical administrative assistant is responsible for any errors made by the medical staff. Option D. The medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 45. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation. The first Korokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 46. The primary purpose of wearing gloves during phlebotomy procedures is to protect the Option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 47. Narrowing of the valve between the left atrium and the left ventricle is called. Option A, mitral stenosis. Option B, aortic stenosis. Option C, pulmonary stenosis. Option D, tricuspid stenosis. The correct answer is option A, mitral stenosis. Explanation. Mitral stenosis is narrowing of the mitral valve, which lies between the left atrium and left ventricle. Question 48. The method of scheduling in which one patient is scheduled for a specific appointment time is known as Option A, single booking. Option B, standard scheduling. Option C, cluster scheduling. Option D, fixed appointment scheduling. The correct answer is option A, single booking. Explanation. Single booking schedules one patient for one specific appointment time, giving each patient an individual time slot. Question 49. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 50. Which of the following skills would not be an appropriate expectation of the competent medical assistant? Option A, giving instructions to patients about self-care after treatments. Option B, diagnosing common patient symptoms. Option C, performing insurance coding and billing. Option D, using the computer to perform a variety of office functions. The correct answer is option B, diagnosing common patient symptoms. Explanation. Diagnosing symptoms is a provider-level clinical responsibility and is not an appropriate independent duty for a medical assistant. Question 51. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 52. The National Health Insurance Plan for Americans age 65 and older is Option A, Civilian Health and Medical Program of the Department of Veterans Affairs. Option B, Medicaid. Option C, TRICARE. Option D, Medicare. The correct answer is option D, Medicare. Explanation. Medicare is the federal health insurance program that primarily covers people age 65 and older and also covers certain younger people who meet eligibility criteria. Question 53. The main purpose of personal protective equipment is to: option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 millimeters of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 54. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on: option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium. Question 55. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 56. Notifiable infection must be reported to: option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 57. Defamation through spoken statements is known as: option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 58. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation. Aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 59. The patient information sheet contains: option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 60. Az's toll. Option A, is defined as the presence of chaotic cardiac activity. Option B, produces a complete cessation of cardiac output. Option C, is the most common primary event in cardiac arrest in the adult. Option D, appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Az's toll means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 61. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately: option A, 5 grams per deciliter. Option B, 5%. Option C, 45%. Option D, 45 grams per deciliter. The correct answer is option C, 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 62. The patient's specimen is lipemic. This is usually an indicator that the patient is: Option A, smoking. Option B, not fasting. Option C, normal. Option D, in basal state. The correct answer is option B, not fasting. Explanation. Lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 63. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 64. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 65. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 66. Which of the following supplies blood to the heart muscle? Option A, coronary arteries. Option B, brachial arteries. Option C, carotid arteries. Option D, cerebral arteries. The correct answer is option A, coronary arteries. Explanation. The coronary arteries branch from the aorta and deliver oxygenated blood directly to the heart muscle. Question 67. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation. Rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 68. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 69. A baby's pulse and respirations are: Option A, the same as adults. Option B, not significantly different than an adult. Option C, faster than an adult's. Option D, slower than an adult's. The correct answer is option C, faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 70. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 71. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 72. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation. Heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 73. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 74. Which body system has the liver, gallbladder, and pancreas as accessory organs? Option A, digestive. Option B, endocrine. Option C, integumentary. Option D, lymphatic. The correct answer is option A, digestive. Explanation. The liver, gallbladder, and pancreas are accessory organs of digestion because they produce, store, or deliver substances that help digest food. Question 75. A normal resting heart rate for the average adult is: Option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 76. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 77. Issues relating to medical advances come under the heading of: Option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 78. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 79. Which of the following would be filled second? Option A, Tommy Turner. Option B, Thomas Turner. Option C, Tom A. Turner. Option D, Tommy Turner. The correct answer is option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 80. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed: Option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 81. The four symptoms of inflammation are erythema, edema, pain, and: Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation. The classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 82. The tube of choice for glucose testing is: Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 83. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 84. After obtaining an electrocardiogram tracing, a medical assistant would be expected to: Option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 85. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 86. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 87. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 88. If a laboratory test requires serum, which vacutainer tube is the tube of choice? Option A, lavender top tubes. Option B, black top tubes. Option C, yellow top tubes. Option D, red top tubes. The correct answer is option D, red top tubes. Explanation. A red top tube allows blood to clot so serum can be separated, making it appropriate for tests that require serum. Question 89. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 90. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 91. Insulin syringes are calibrated in: Option A, milliliters. Option B, units. Option C, cubic centimeters. Option D, minims. The correct answer is option B, units. Explanation. Insulin syringes are marked in insulin units so the ordered dose can be measured according to the insulin concentration. Question 92. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 93. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 94. Another term for outpatient care is: Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation: ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 95. Every prescription for a controlled substance requires the physician's signature and a number? Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation: controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 96. The patient complains that it hurts when they swallow. This type of complaint is considered option A, assessment. Option B, plan. Option C, objective. Option D, subjective. The correct answer is option D, subjective. Explanation: pain with swallowing is a symptom reported by the patient, so it is subjective information rather than an objective finding directly measured by the examiner. Question 97. Family members, such as spouse or children that are covered under the member's insurance policy are known as option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation: dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 98. A patient came into the doctor's office with chest pain and shortness of breath. Which position is the best to help him breathe better? Option A, lithotomy. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option C, Fowler's. Explanation: Fowler's position raises the head and upper body, which can improve chest expansion and make breathing easier for a patient with shortness of breath. Question 99. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation: the kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 100. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 101. Collection devices used in skin punctures are called option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation: capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 102. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called option A, loyalty. Option B, dependability. Option C, courtesy. Option D, flexibility. The correct answer is option A, loyalty. Explanation: loyalty means faithfulness or allegiance to a person, organization, cause, or principle.